Let's talk about insomnia. So, what is insomnia exactly? We all think about insomnia as difficulty sleeping, but there are some specific definitions that are important to consider. So, we have chronic insomnia, which is the longer term difficulty sleeping. We also have short term insomnia disorder. In addition, there's other reasons why someone might have difficulty sleeping or insomnia. And really, when we define insomnia itself, it is a dissatisfaction with sleep quantity or quality. Okay, so there's a certain point with which it transitions into these other types of subcategories. For it to be considered more than occasional insomnia, it needs to be 3 or more nights per week for 3 or more months. And it can include a difficulty in initiating sleep, a difficulty in maintaining sleep, or waking up very early in the morning. As a result of these difficulties with sleep, someone might experience significant impairment in their day-to-day activities or cause significant distress that impairs them. And that impairment is part of the qualifying criteria there. Now, there's a number of different reasons that it's been postulated that people have difficulty sleeping. There is a genetic component, so people who have a family history significant for difficulty sleeping. There are some neurotransmitter modulators that are considered. So changes in things like GABA, which is one of our primary inhibitory neurotransmitters, versus glutamate, which is an excitatory neurotransmitter, and some polymorphisms or SNPs in the expression of things like receptors and use of neurotransmitters. There's also a neurobiological process component. So we have parts of our brain system that stimulate wakefulness and parts of our brain system that stimulate sleepiness. And when those two balances are dysregulated, it can result in sleep disorders, including insomnia. That reduction in GABA, that inhibitory neurotransmitter in the cortex, also seems to potentially contribute to it. And there are some like neurobiological brain changes or abnormal morphometry that can be associated with development of insomnia. And then hyperarousal. So there's pieces of the EEG or electroencephalogram that can be seen around sleep time that can vary in individuals who experience insomnia. So increase in high frequency of their EEG waves around the time of sleep, increasing sensory information processing, so that excess stimulation, and arousals during rapid eye movement sleep. And then, of course, there's some psychological and behavioral processes that are related to difficulty sleeping. So anxiety-based issues, right? So someone who has anxiety related to sleep or hyper vigilance during sleep time, and this causes almost like a I don't want to say obsession, but obsession with sleep. And you do the clock watching, right? You look up, you go, okay, if I fall asleep now, I have 6 hours. If I fall asleep now, I have 5 hours and 50 minutes. And it causes an increase in worry and actually activates your nervous system into that kind of fight, flight, freeze, or appease response. And then people who engage in behaviors that make it more difficult for the body to receive the idea that it's time to sleep. Right? So things like poor sleep hygiene that we can talk about in a little bit. So aspects here, environmental aspects, right? We have situational stressors, things like work, major life events, interpersonal conflicts. You can have poor sleep hygiene with irregular schedules, screen time when you're in bed, doing activating activities before falling asleep. Things like anxiety, depression, mood disorders, personality disorders, substance use disorders can all contribute to it as well. And then medical conditions. So people who have poorly treated pain, people who are experiencing an upper respiratory infection and their nose is clogged and they have a headache, people who have hyperthyroidism, individuals who are pregnant, if they have other respiratory issues like asthma or COPD, if they have heart failure where they feel fluid kind of building up in their chest when they lay all the way down. So things that can make it more difficult for someone to fall asleep and or stay asleep. So we're talking about management. There's some important pieces that I want to spend a few moments on, and that's going to be our non-pharmacological or non-medicine interventions, which really are ideal for most situations, especially long-term. The first thing is CBTI, or cognitive behavioral therapy for insomnia. This is considered a first-line intervention and is widely recommended throughout all the guidelines that review insomnia. It is a multi-component type of therapy that includes things like daily sleep diaries, stimulus control, consolidating sleep, so things like not napping during the day. Interesting one that I like to do sometimes is actually scheduling worry time. So if you actually create a space for yourself to worry about the stuff of the day that's not right when you're trying to fall asleep, that can help. Those reframing techniques, restructuring techniques can be really helpful there as well. And it's all part of shared decision making about those changes and introspection into what's going on with someone's difficulty sleeping. Now, one thing that we can recommend really across the board, everyone should try to engage in this, is something called sleep hygiene. Now, sleep hygiene alone does not treat chronic insomnia. However, if someone has intermittent insomnia, some difficulty sleeping, some, a negative relationship with sleep, then these things can actually help improve that consistency and quality of sleep. It's really effective as monotherapy for chronic insomnia, though. That's important to note. So keeping regular sleep and wake times. I know we like to sleep in on the weekends. Trying to be consistent with when you go to bed and when you wake up will really be helpful for a lot of people. Trying to avoid napping during the day. Now, there's exceptions if you have a hypersomnia issue like narcolepsy, but for most people, daytime naps can disrupt their circadian rhythm. Avoiding large amounts of liquid in the evening so you're not stimulated to wake up to use the restroom. Making sure your environment is very comfortable, so cool, quiet, safe, dark, all of these kinds of things. Doing something relaxing and enjoyable before bed. So taking a nice bath or reading a book or something like that. Using bed only really for sleep. And the other thing that a lot of people do in bed, regular exercise, but not right before bed because that can be activating. And then avoiding things that disrupt our sleep EEG patterns as well as can be stimulating. So things like nicotine, which is stimulating, alcohol, which although makes people feel sleepy, decreases significantly the quality and depth of their sleep, and caffeine, which is also a stimulant.